Good afternoon, everyone. Well, depending on where you are. I hope you're all doing well, and thank you for taking the time to join us today. Before we get started, I just wanted to let you all know that this is in webinar format. So while your camera and audio is off, we invite you to ask questions throughout the presentation, which you can do in the Q&A button on your toolbar, and we'll be answering those questions live. Also, a recording of this video will be available after, so you can revisit as well. Now, it's my great pleasure to introduce our speaker, Brigitte Chiomba. She is the Director of Dialysis Services with history in nursing and holds her MBA in healthcare management. Today, she will be going over dialysis and how to optimize your care. So without further ado, please welcome me in joining Brigitte. Brigitte, the floor is yours.
Thank you. Hi, like she said, good afternoon, or, from wherever you are streaming from today. Like she said, my name is Brigitte Chiomba, and I am in the dialysis space. Started off as a nurse and worked my way up to now I am the Director of Dialysis Services for a company in the Midwest. I worked for a company that invested in long-term care facilities, but it was their strategy to go ahead and add dialysis to their service line. So I am working with them right now. We started dialysis units, and so far we are in 3 states, and that's what I'm doing. Like I said, my origin is in nursing, and I've been nursing in so many specialties, but I ended up in dialysis, and I love dialysis. I'm passionate about dialysis, and I'm glad that today we are in this session talking about dialysis. I know it's overwhelming. Like when people hear about dialysis, there's so many questions, and some positive, some negative. But I am here to answer all your questions, and I'm here to try and clarify exactly what dialysis is and how to take control of your own treatment and your own care if you're on dialysis. And if you are a CKD patient, take your own care, take control of your own care, and slow the progression for you to get to end-stage renal disease and not even get to end-stage renal disease. So today we are going to go through basically the dialysis basics, like what is dialysis, who gets on dialysis, when do you get on dialysis, and then what are the modalities? We got different modalities in dialysis, and they all have they have their pros. And we don't pretty much talk about cons, but we talk about what to consider, because everything has a different consideration to take in mind. But at the end of the day, everybody's care is personalized. So it's pretty much what you decide, what you and then your nephrologist decide, and what your family decide, and what you yourself decide that would be best for you. And then we'll also talk about how to optimize your experience, because as much as people get on dialysis, we want them to have a full life. We want them to have quality of life. So how do we do that? How do we optimize this experience, make it more positive than negative, and make it enjoyable? Because it's a journey, and it has to be enjoyable for people to be able to do it, to be able to make it in life. And then we have to see, how do you cope with dialysis when you receive the diagnosis that, okay, now you're in end-stage renal, okay, now you're in CKD1. How do you maneuver that? How do you navigate all that to make it be positive in your life, to make you be able to do what you do on your normal day, what you do, what you'd like to do, and what you do, and not be restricted because now I got this new diagnosis. And then we have the Q&A session where we're going to open the floor to questions that we may have. And if we are not able to answer your questions today, we'll follow up with feedback And there will be an email, there'll be a number at the end of the session that you can call. Next slide, please. Okay, so what is dialysis? Pretty much it's a life-saving procedure. It's something that takes place in the body. Hold on a minute, I have to do something at my computer here. Okay, it's something that takes place when the kidneys stop failing, or when the kidneys stop functioning as a normal being. And what happens is, like, it's a procedure where somebody has to come to and do this two types of dialysis. One is done in the center by professionals, and the one is done at home. And the whole goal for this is to take to help remove toxins, waste products, and excess fluid from the blood. Because in normal people, our kidneys are able to excrete all that out for us through urine. But when you are getting on dialysis, you have to go and do this in a center, or you go do this at home using artificial kidney. The artificial kidney is what helps you to remove your toxins, waste products, and excess fluid from the blood. So there's always, like, there's people that just go straight into dialysis, but there's also stages that will lead one to dialysis. So when is it needed? At what point does somebody get to need dialysis? The nephrologists who are over the care of everybody will be able to tell you when is the right time to get on dialysis. But also the nephrologists have to hear from you the symptoms and the signs that will put somebody on dialysis. And at that point, that's when you agree with the nephrologist, and then you make a decision that, okay, now it is time for me to go be on dialysis, because I've been deemed to be a dialysis patient because my kidneys are not working well. And having said that, the people who are everybody, a new diagnosis is overwhelming, but there's so many resources out there. There's so many professionals out there, and like, this is one of the resources that we're using today, just to make sure that you guys have a role in your own care. This toxins build up in the body because the kidneys are not able to do what they're supposed to. So that leads to accumulation of fluid. And when you have this fluid, that fluid will push on your lungs, and it will lead to somebody having shortness of breath. When you have shortness of breath, it's going to be hard to breathe. And we know respirations is one of the things that can cause serious complications, because we have to be able to breathe. So at that point, that's when dialysis is required to prolong life, or some will be referred to a kidney transplant. But most of the times, a kidney transplant comes on later on in the process. The first thing that happens is dialysis. And dialysis is there just to prolong somebody's life. It's not there to restrict anybody's life, but it's there as a measure to prolong life. And people on dialysis can attest to having a quality life. It might be like a time constraint, because you have to allocate time to be on dialysis. But overall, you can have a normal and quality life when you're on dialysis. Next slide, please. So, like I said, dialysis, you just don't get on it. Some people get on it or crash on it, but most people, it's like there's a long-term condition that they have, that they are told, now you have a chronic kidney disease. And a chronic kidney disease is a disease that happens because the kidneys are gradually losing their function. And this doesn't happen over time. It happens over time. It happens overnight to some people, but mostly a lot of people, it happens over time. And it can result from different causes and different comorbidities, including diabetes. If you have a diabetes that is not controlled, it can affect your kidney functioning. If you have hypertension that is not controlled, you can progress, you can have chronic kidney disease. If you have glomerulonephritis, you can also proceed to CKD. CKD can lead to kidney failure, and it has their own complications. And one of the complications is the final diagnosis of ESRD itself. So how do they measure this CKD? It is measured in stages with a test, and that test is just a key function that assesses the kidney function. This will be done at the doctor's office, and once the doctor's office sees that you're going to CKD, which is chronic kidney disease, they'll refer you to a nephrologist. The nephrologist will get you through all these stages, and they'll be monitoring you through stages 1 through 5. The normal estimated glomerular filtration rate is supposed to be 90. So if you're less than 90 per milliliters per minute, now you're deemed as, now you have chronic kidney disease. So it's put in stages according to how many meals per minute your body is able to excrete these body weights and toxins. So if you if they say you're stage 1, that means this rate is greater than 90 meals per minute. And if you're 90 meals per minute, that means you're normal. But if you're less than 90 meals per minute, you are going to be in stage 1, and that is just less than 90. If you are stage 2, you are between 60 to 89. So that's for stage 2. Stage 3 is when you are 45 to 59. And stage 3 is when you are 30 to 44. Stage 4 is when you're 15 to 29. And stage 5 is when you're less than 15. At that stage, from stage 5, that's when you are probably most likely to be put on dialysis, or you'll be put on a transplant. And dialysis can start as acute kidney injury dialysis that you just needed for a moment, or it can be end-stage renal disease where you need it for almost your lifetime unless you can get transplanted. And you as a human being, you have your own contribution to this. Because if you meet a nephrologist, if you meet your doctor, they'll be able to tell you what you can do to prolong the stages. So it's up to you to work with the nephrologist, to work with your doctors to prolong the stages so that you don't get to stage 5. Because if you get stage 5, that's when you have to proceed to the next stage, which I talked about, which is either the lifetime long dialysis or the short dialysis or the transplanted. Next slide, please. So how does it work? Now we are at that stage 5. Our estimated glomerular filtration is less than 15. What happens? That's when you meet your nephrologist and they are able to tell you that now we have to do that dialysis. Now your kidneys are not working well. At this point, we have to bring an option of dialysis. What is this dialysis? Dialysis is pretty much done through a semi-permeable membrane or an artificial kidney named the dialyzer. A semi-permeable membrane is used if somebody's doing it at the comfort of their house. And the artificial kidneys is also used in the home, but mostly it's used in the dialysis unit itself. There are so many units, and now there's so many companies that are able to offer dialysis. And what they do is you work there in this semi-permeable membrane, or the artificial kidney works to filter your toxins, because at this point, it has been deemed that your kidneys cannot handle the toxins, so they cannot excrete them like they did before, because now your filtration rate has gone lower. your waste products are not being removed. I know because a lot of people will be questioning, like, why do I have to go on dialysis when I'm still able to urinate? But the urinate, you can still be able to urinate, but the concentration of the toxins and the waste products is not as highly as somebody who has a normal functioning kidney. And also because of that, you're not able to get all the fluid that you have in your body. It starts moving into other spaces where then dialysis has to come and get this fluid out of these spaces. For hemodialysis, this blood goes through a dialyzer, and there's so many different sizes according to your body mass. It's some people, when they are smaller, they have a smaller dialyzer. If you have a bigger body mass, you also have a bigger dialyzer, and this dialyzer acts like that kidney and is connected to a machine. And what it does is like it takes blood. We have lines that takes blood from your body. It goes through this artificial kidney, and then this kidney cleans up the blood, takes away the excess fluid, and then return your normal blood out to your body. So it's just like, it's kind of work because your body, you're sitting down in chairs, you're doing all that, but your body is going through some work. For peritoneal dialysis, it's where you use your own semipermeable membrane. People might have this, it's a membrane that is put in your stomach. And you have to go through stages because a surgeon has to make sure that according to the anatomy of your belly, you can be able to harbor this semipermeable membrane. And that membrane, we use dialysis solutions that, they go through the membrane, they go in your body, and they change the chemical composition so that that fluid pulls this excess fluid, it pulls this excess water in your body, and it pulls this extra toxins out. So by the time that this fluid is coming out of your body, it has chemically been able to absorb all that waste, all that excess fluid, and all those toxins. So that is called peritoneal dialysis. But you and your physician and your family and your primary care physician are the ones who decide what is the best option for you. And lifestyle has so much to do with these two, because if you have a job that you travel all the time, or you have a lifestyle that you're not at one place, you have to choose a dialysis modality that will also be tailored to your lifestyle. But pretty much your doctor will be able to help you determine the best treatment option. And your family will be able to help you with that decision too, and so will your doctor be able to help you too. Next slide. So the first dialysis that we're going to talk about today is the clinic hemodialysis. This is the dialysis that happens in a center. It happens in a center where you have professionals in there that pretty much takes care of your treatment. In this modality, the blood is filtered using an artificial kidney called the dialyzer. Dialyzers come in different sizes according to somebody's body mass and body mass index. These dialyzers are connected to a big dialysis machine, and they have their own trained nurses, dialysis technicians that perform the treatment and the care. They pretty much set up the dialysis machine according to your prescription, because your doctor, your nephrologist will order how long you have to be on this machine, what dialyzer size they have to use, and what type of acid and everything is tailored to somebody's personal treatment. And that's just like, we go to a doctor and somebody gets on 25 milligrams of amlodipine, and somebody gets 50 milligrams of amlodipine twice a day. That's the same thing with dialysis. Clinic dialysis comes with a prescription. The other good thing about this clinic hemodialysis is that supplies and equipment are stored at the center. Like you walk in, they show you your chair, you go sit down, and they do everything for you. and you don't have to take home anything. Everything that you use is stored at the center. And the other advantage is the care team is available. If you are supposed to be there dialyzing for 4 hours, the staff are there 4 hours during your treatment, and they are there to monitor all your complications or anything that might happen to you during that time. And the other also advantage is the care team, which includes a dietitian, a social worker, a nephrologist, or renal nurse practitioners, and a facility manager. They are pretty much taking care of everything that pertains to your dialysis in these centers. The dietitian will tell somebody what you can do, what you are supposed to eat, and what you're not supposed to eat in order to make your experience tolerable. The social worker will be there to tell you what resources you have, what insurances to go for, and what programs is out there to support people on clinical hemodialysis. And your nephrologist is the one who sits down and see what treatment is best for you, because not everybody is the same. Everybody is different, and so are all these dialysis treatment prescriptions and medication. And then you have the renal nurse practitioners that pretty much runs and see how you're doing on dialysis. And they're the ones who tweak your treatment. They are the ones who would help order medication if you need to be on one medication because the other one is not working. And then you have the facility managers that make sure that all these interdisciplinary teams are contributing to the positive experience of your being on clinical hemodialysis. So having said that, the question is, what is there for me to consider? What is there for you to know about this modality? First things first is this modality, you have to go to a center. And we know not everybody is able to drive. Not everybody has family that can drive them. We have to rely on transportation companies. And they have their own problems, like somebody will be late to treatment, or sometimes you'll be at the treatment center waiting for an hour because of transportation. So that is one of the drawbacks of this. That is something to consider. But there are people who drive themselves, or there are people who have their families transporting them. So that is not a factor for them to say, I cannot do clinical hemodialysis. There's also there will be schedule interferences with activity of daily living because they have their own time slots. It's just like if I make an appointment to the dentist, he'll tell me what slots are available, and I will choose what I can do. Considering dialysis is done 3 times a week. So that means there's a schedule for Monday, Wednesday, Friday. So that means Monday, Wednesday, Friday, they'll tell you a day when they can have your slot. Or others go Tuesday, Thursday, Saturday, they'll tell you a slot that you can go and do. So that's some of the things to consider. And also, like, according to what access you have on your body that they can use with spatula, where they have to put like big gauge needles. These needles are as big as 17 gauge, they're as big as 16 gauge, they are as big as 15 to 14 gauge. And every time you go, they have to get access to your blood by inserting these needles in your access. And also there's a risk for infection, because respiratory infection, if I go in a unit and somebody has flu, I'm at high risk to getting flu because I'm sitting next to them, or I'm at least to get something that they have because I'm going to go sit in a chair next to them, or I'll go sit in a lounge in order for me to get into the center. And there's also a risk of occasional blood loss, because sometimes, like I talked about the needles, there's a possibility for them to dislodge. When they dislodge, you bleed a little, but they have all these professionals that will take care of that they make sure that you don't bleed a lot. And also it's attached to fatigue, because it's like you go sit in a chair 4 hours, your blood is coming in and out, in and out. And after it, people are fatigued. They don't have energy to do anything between treatments. But the thing about it is the next day you're off. If you go Monday, Wednesday, Friday, that means Tuesday you're home, Thursday you're home, Saturday, Sunday you're home. So that's some of the things to consider if your clinical hemodialysis is your option. Next slide, please. Home dialysis, this is the dialysis that you're able to do at your own home, and pretty much you're in control over this one. Because if you're using a dialysis machine, you are the one who sets up the machine, and it also has an artificial kidney that you use, but you're the one who is over this because there's nobody else in the home to help you with it. You can call the center because you'll be attached to a center, or you can call to a company who's the company that makes the dialysis machine. But pretty much everything that you do in this modality, you are the one who's taking care of it all. So what are the pros for this type of dialysis that is done at home? There is high flexibility with scheduled treatments around daily activity schedule, because if the doctor orders 3 to 4 exchanges a day, you know when to slot them. You are able to wake up at 6 in the morning and do it, or even 4 a.m. in the morning and do it. And then I have also my next exchange is at so and so a time. So you pretty much you have control over what you do, and it can revolve around your dialysis, your daily activity schedule, compared to the clinical hemodialysis, where they tell you at what time to be there. And also there's people before you, there's people after you, so you have to be mindful of your time. The other thing about this modality is no travel is involved, because that's the big hiccup, is getting to and from from the dialysis unit, and transportation seems to be the #1 problem. But with this, you don't have a problem. The other thing is there's more frequent hemodialysis comparable to the natural kidney, which can be like you have your kidneys are functioning, because you can do it as much as you can according to your prescription. But for hemodialysis, if they say you're supposed to be here Mondays at 10 a.m., if you miss it, you miss it. They can put you on another day, but they have to liaise according to the treatments and according to the staff that we have at the center. The other thing is there's privacy of doing it in the comfort of your own home, because you don't have to go sit next to somebody you haven't seen before, or you don't have to go deal with staff and everything. You are in your own comfort of your own home. So having said that, what are the things to consider in this modality? First and foremost is you require a lot of space in your home, because you have to bring in equipment and supplies. And this equipment is not that big, but your supplies, it's a lot, because usually they'll come and deliver 1 month supplies. And it's a lot of bags, and it's a lot of supplies. So you have to make sure you have that kind of space in your house. Otherwise, it's going to be hard. You need a trained care partner, because they do that what is in case you are sick and you're not able to do it. Somebody has to be able to do it. And it doesn't say that if you live alone, you cannot do this. People get their nieces, people get their nephews to help them. You just have to have somebody in your family who will be able to do it on your behalf. The other thing about this is you have to have training, because you cannot do this without training. So you have to have 4 to 6 weeks of training on how to perform the treatments. And also after that training, you take an exam, and you have to make sure and be confident that you'll be able to do it on this treatment. This training can be extended, and it just depends on how you absorb it, the skills and the systems. But the minimum that it can be is 4 to 6 weeks. And if you have an access where you're using needles to do it, you have to be able to stick yourself. You have to be able to find your fistula and be able to find access to connect to the machine. So this is about home dialysis. Everybody's different. Some people do this best, But that doesn't mean if you opt for this option, if you fail, then you're done. No, you can go back to the other modality, and there'll be your nephrologist will be able to find a center and everything for you to go. Next slide, please. Now I'm going to talk about PD, and this is another type of dialysis, and this is also done in the home, but this is where you have that membrane I was talking about, and it's put in your belly. It's like a filter, and what it does is it has fluids coming in and fluids coming out. So it brings in a fluid that is more chemically balanced to come in and get and pull solids and pull weights and pull toxin from your own body fluids. And that is done through a catheter that is put into the segment of the belly. After a specified amount of time, this fluid will get in your belly. It will dwell, we call it dwell time. It will dwell in you for like 2 hours or 3 hours or 4 hours, but it all depends what prescription your nephrologist has put you on. And then it comes out after that 3 hours, after 4 hours, and then it comes out with all the waste products from the abdomen. What is the positives about this? Pretty much is a flexible treatment schedule again, because you are the one in control and you know when to do it. The dialysis itself compares to the natural kidney function. So if you're able to do it and there's no problems, then it's just like you have a normal kidney that is functioning in your body. The equipment is portable. So for people that like to travel, you can put this in your car and you can travel. You can go on vacation. You can go visit family. You can work and be on the road because you have the equipment with you and you're over your. If you're doing it at home, there's that privacy that we talked about before, because you're doing it in your home at your leisure time and in your family, your territory. So this is another positive thing about it. And you don't need needles when you're traveling because you're doing it through your own filter that is put in your belly. So you don't have extra consumables when you're traveling. You are very empowered with your own self-care because you know what time to dwell these fluids and what time to take them out. Then you don't have to travel to the dialysis facility 3 times a week. You do it in your own home and you know when you do it. And the other thing about this, you have 24 hours access to technical nursing support. So if something happens, they're able to troubleshoot with you over the phone. Okay, so what is there to consider about choosing this? One is the risk of infection, because you are accessing a filter that is embedded on your belly, and you have to be extra careful. Like, nothing should come into that. It's a sterile area, and you have to know how to clean that area to avoid infection. There's possible weight gain with this, because not all the fluid that you put in your body comes out. Sometimes that fluid shifts to other places and they don't come out, so they amount to body weight gain at the end of the day. The presence of having a dialysis catheter in the abdomen, some people, it doesn't sit well with them. They don't want anything in them that was not in them when they were born. So that's something you have to consider. This one, the training is not as long. You have 1 to 2 weeks training on how to perform the exchanges, but the big thing is for you to keep your access sterile, because you don't want to have infection. There's minimum of once a month travel to a dialysis facility for a blood draw and follow-up care, because they have to make sure that your filter is clean and dry and that there's no signs of infection. Because if there's no signs of infection, they need to take care of it right away. It requires also enough storage space in the home for supplies and equipment, because all these supplies are delivered to your own home. Next slide, please. So it's up to you, your family, and your nephrologist and your primary care physician to tell you which way to go to to choose a modality. But once you're on dialysis, what are the other things that you can do to have a positive experience? The first thing that you have to do is commit to a full dialysis session each time. We don't recommend anybody to shorten or miss your treatment prescribed time, because what happens is you are not cleaned so well. So every time you're not cleaned, there's some toxins left, and they'll build up after time if you keep on not attending your full dialysis session, or if you shorten it, you still have some toxins that we are not able to get to, or if you miss your prescribed treatments, that means you miss the whole time and your body is not clean. So when you come back, whether you're doing it yourself or whether you're doing it in a center, you have to work extra hard, because now you're working double to make up for the time that you lost last time when you were not there, and also to add in what has to be today. The other thing you have to make sure that you're doing is take your medications as directed by nephrologist and your primary care physician. If you're on dialysis, sometimes we have there's phosphorus. Your body is not able to break down phosphorus like a normal person, and also two, it's not able to break up calcium, and so you take medications with food. But some people don't. They go out a lot, they go eat out a lot, and they miss their medication. But we always recommend that you take all the medications in order to have a positive experience. There's also a dietitian, and they will tell you what to eat and what not to eat. So remember, dialysis is a lifestyle change, because they'll tell you what you have to eat and what not to eat. And we know we all have our favorite foods, but at this point in time, maybe your favorite food is not the recommended food. But please eat well and manage your fluids. There's people who like to drink a lot, because there's an allowance of fluids, how much you can eat according to the way that your body weight is. So it's very, very recommendable to stick to your renal diet and to stick to your fluid allowance, so that you don't go above it. Because if you go above it, sometimes it can lead you to having complications that if it's not your dialysis day, you might have to call 911 so that you can get help. So please stick to your renal diet and your diet options, and always ask your renal dietitian if you have questions. Ensure, if you're doing it at home and you're doing it yourself, ensure that all your lines and that your access is pertinent. We send people out to go meet surgeons. We send them out to our access center so that they can maintain their access and make sure that their access stays as long as we need it to work. And they'll tell you how to take care of your access. And another point is the infection again. Make sure that you know your signs and symptoms of your access. If it's getting an infection, it needs to be taken care of before it gets to be worse. And we don't stress enough, do not exceed your fluid allowances between treatments. Because some people, sometimes they go out in the summer, they drink a lot, but your body at this point can swell up, and even people can see from the outside that you have a lot of fluid on board. The last point is educate yourself about your dialysis treatment. Know your numbers. Know how long am I supposed to be on treatment. Okay, what is my acid that I use when I'm on there? And when they draw my labs, what is my optimal lab results? Where am I supposed to be? And if I'm not there, what can I do when I go home to make sure that my labs are up to par? Next slide, please. So this is just statistics to show what happens when somebody is in compliant with their dialysis treatment times. Because not having enough dialysis will leave too much waste and toxins in the body. And when you do that, there's a high probability of somebody ending up in the ER, because what happens is somebody gets sick, they are so weak, they get nausea, and sometimes this nausea can even lead to vomiting, and that is not a good experience. you can have a taste of ammonia in the mouth, and that's people don't like it. They say it's gross, they say it's nasty. So it's very important for you to make sure you're having your food dialysis, you're not missing your treatment. And sometimes it's because of all those too. If you have nausea, if you have a taste in your mouth, you have poor appetite. And that poor appetite will lead you to losing weight. And also it changes a lot of body chemistry. So please, stick to your dialysis prescribed time and do the right things when you're on dialysis. Swelling of the body, including the heart. And when the heart is affected, it's always hard because the heart pretty much controls everything in the body. So at that point, if you have a swelling in your body, now your heart is swollen, then you have to go see a cardiologist because the diet is now out of the hands of the nephrologist. So on this table, we have minutes lost with treatment. So let's say every treatment 3 times a week. If you have 3 times, if you have 4 times, you're missing 10 treatments. At the end of the year, those treatments will add up to 1,560 minutes. If there is 1,560 minutes, that adds up to 26 hours that are lost per year. And those hours is something that leads to mortality because now you're taking away from your wellness. If you miss 20 minutes, it adds up to a total of about 52 hours after a year. If you miss 30 minutes, it adds up to 78 hours in 1 year. So all this will affect your body. And at one time, the body can do it, but it can only do it to a certain extent before it all becomes complications. And we don't like for people to go in and out of the hospital because of dialysis complications when it could be prevented. So we always, always, always encourage for people not to shorten or miss their treatments. If you have another appointment that is important, please schedule those appointments outside your treatment days and treatment times. And also, we always encourage our patients to get on a transplant list. The social workers will help them. There's so many appointments that you have to have with the transplant centers, and we always make sure that we also we can reschedule people's treatments just to make sure that they are able to go meet their transplant coordinators and make sure that they get on the transplant list. Next slide, please. So having mentioned all that, how can one cope with dialysis? It's a lot. It's overwhelming, especially when you're in a community where nobody's on dialysis, especially if you're the only one in your family. How can you cope with dialysis? First things first is, they say a problem shared is a problem that other people care about. So share your feelings and speak without holding anything from your family. Share it with your friends. Share it with your care team. There will be some people that, they have other friends who have been on dialysis maybe 10, 15 years. Try to see what are those people doing that is working well for you. What is working well for somebody is not what you have to do to work well for you, but you find a medium somewhere on what would work for you. But please be open and share these feelings with the people around you. The social workers are there. They went to school and they were trained on how to be a great liaison for you and your team. They know the resources. They know somebody who's been on dialysis, what they have done, and they are trained to provide counseling, and they're also out there to identify other resources for you. If you're having problems getting your medication, they'll tell you where to go. If you're having problems getting food, they'll tell you where to go, and so on and so forth. Although you oversee your own treatment, but involve your family in your discussions and decisions. Because your family are there for you and they'll help you. They're there for you if you can't do it. Like I said, in home dialysis, it has to be somebody in your family who can come in and help you. They can go and get resources for you. They can go there and fight for you. They can go there and help you to go to groups. If there's groups out there for dialysis support, it will be the same family who are going to help you to go over there and hear about what other support groups are out there. Regular exercising, I cannot stress enough, helps improve quality of life and is a benefit to most patients. I know there's so much fatigue and weakness associated with dialysis, but we always recommend for people to have regular exercises. And I know there's chair exercises that you can do. There's meditating exercise you can do. There's yoga. You can have yoga, and it's not physical. You sit down and you meditate, and you can do chair activities. These are all things that will improve your quality of life. These chair exercises, like I can say, they are easier and lighter. And you can always go and ask your social worker, or you can ask your nephrologist, like, what chair exercises do you recommend for me? And they'll be able to share from what they have. Eat well, limit salt and high potassium in your food choices, because these are the two elements that pretty much will let you have a lot of accumulated body fluid, and these are the ones too that will at some point require you to take medication so that the body is able to break them down. Controlling the amount of fluid is very, very, very important, because what you consume between treatments will determine what type of dialysis you're going to have when you have your dialysis treatment. So our challenge to you having these sessions is in order to equip you and encourage you to know your own role that you play in your dialysis care, because it's very important for you, and you know, if you know what your body needs, and you know what has been ordered for you. If you're in charge of your own dialysis, you have to be very careful. You don't want to have an infection and end up in the hospital. If you go in a center, you have to make sure you know how they're cleaning your access. You have to make sure to know what the dialysis professionals do at what point, and when and how. Because sometimes there'll be people that do not work with you every day. Your dialysis regular staff might go on a vacation when somebody else is in that unit. What do they have to do? What is still being done daily? If you don't know what is good for you, they can come and do something that can even harm you. Next slide, please. So I know I've shared a lot of information today. It's a lot. I don't expect anybody to sit out there and absorb all this and know what is what. But we are here to help in the so many resources. But always remember that the type of dialysis that's right for you depends on your lifestyle and other considerations which your nephrologist know. Other considerations with your primary care physician know. So make sure that there's communication between these two professionals, because your doctor and your nephrologist will be the ones that can determine the best treatment option for you. And also consider your family. Your family is pretty a bigger part of your life every day. So remember that there have to be communication between everybody who I've talked to in this slide. Next slide, please.
Ask a question for Bridget to answer live here. You can go ahead and ask it in the Q&A button. I have one question that just came in, Bridget, if you would like to answer. It asked, how long can I put off dialysis? I'm stage 5, but keep hoping for a miracle.
It all depends on what you're doing, and your nephrologist will tell you exactly what you have to do in order not to get to ESRD. Like I said, some stuff is take your medication. Don't miss your medication. If you have high blood pressure, and that's how you got to be on in CKD, and you're CKD5, take your medication as directed. eat healthy foods so that your blood pressure don't stay high. Because the higher your blood pressure stays, the more you're gonna progress in your kidney disease. Exercise regularly. Don't be idle. Make sure that your body is getting the circulation that it needs and that it requires. Do all that, and that will prolong the time for you to get to end-stage renal disease. So just will follow what your nephrologist and what your care team is telling you. The dietitian will tell you, don't drink milk. You can't drink milk because that's a lot of phosphorus. Go for rice milk. Go for almond milk. It gets the same satisfaction. It gets you, it's milk, but it's a different composition of milk. You have to get used to that. Instead of you drinking a whole glass of water, go freeze some grapes. Get some frozen grapes. It will take your thirst away. The same thing that a whole cup of water will do. So that are some of the things that will prolong your will prolong your CKD stages for you not to get to that ESRD. And I think there's another question that if you're already 81, how does your age impact dialysis choices? I think the only thing that I've seen about being that age is you're not a candidate transplant, because transplant ends at the age of 65. So at that point, the only option that you have is dialysis. But as long as you do what you're required in dialysis, you do your dialysis the time that you're prescribed, you eat the right foods, you get to the right resources, you keep your labs up. If they say your hemoglobin has to be 11.1 and higher, make sure that you're eating the right foods, you're getting your medication to get you to 11.1. I've had patients as old as 96 years old who have come to dialysis. They might be in a wheelchair, but they're still getting dialysis and they're able to live and enjoy their families. The next question is, since my CKD has moved into stage 4, I feel I have 1% energy. Can I request dialysis sooner? Yes, you can. You can go to your nephrologist and tell them that, do you think this is a point where we need to start talking about dialysis? But pretty much that test that I talked to you about, the K test is what will determine that. Because doctors just don't want to order dialysis. It has to be justified, because the government goes back and audit and say, okay, Mr. Smith is on dialysis. How did he get to dialysis? The nephrologist has to be able to have statistics to support that you need dialysis. So you might, they might have to change your medications. Maybe your medications, one of them, the side effects is a lot of fatigue, but that has to be with you and the nephrologist. Then there's another question from Veronica. It says, if you start hemo, can we switch over to PD? Yes, you can. Once you are being admitted to hemodialysis, they will go around and tell you what other options you have. If you reach a point where you think, I am ready for PD, I'm ready to go see a surgeon and get that filter in my belly, I got somebody in my family who can help me take care of my own care, yes, they'll switch you to that modality, and they'll tell you what stages, they'll tell you what steps are there for you to do that, and for you to be positive and to have a positive experience and results. Can I get off dialysis once I get on it? For chronic kidney disease, you can. You cannot get to dialysis one day. For acute kidney injury, you can, because your kidneys can recover. For end-stage renal disease, unfortunately, you cannot. But what we capitalize on is the experience. You can capitalize on your experience. And if you sign up for transplant and you get a transplant and you do well with your transplanted kidney, you don't have to get back on dialysis. So there's hope. It's not a death sentence. You can get on dialysis, do the best you can, get on transplant list and get transplanted. They're doing a lot of transplants now than when I first got into dialysis. So you have a choice. You just have to do good, but what you're doing for them to entrust you with more.
Thank you so much. I love hearing that there is that hope because, you've presented so many options and there are options. It's just determining what is best for you and your lifestyle. And uh, it's so helpful to hear you break these down so that our audience and our members can know what they're going into and how to make those decisions to find the best care.
Right, right. People can live 15 to 20 years on dialysis. It's just how you do it. Like I said, it's not a death sentence. It's just something that has been added to your life that was not in your life before.
It looks like we have one more question that just came through the chat if we want to answer this last one. And then for any other questions, just for the audience that's with us right now, you can still reach us afterwards and we'll get those answered as well. But let's just do this last one here. It says, I'm having a catheter for the past 5 months and I'm in the process of getting fistula done in the next 2 months. Is it safe to remain on the catheter so long?
The catheter is not recommended because the catheter, the tip of the catheter goes right straight into your heart. So when you get the infection, it lies from the catheter lumens all the way to the heart. And the heart, that's where the blood is circulated to all the parts of your body. So if there's an infection in your heart, it can be lethal. So the only time we recommend for you to have a catheter is 90 days. Once it gets to 90 days, you have to work hard to get your permanent access. You can have a catheter, but if there's very, very high risk for infection, and if you get the infection, there's a very high risk of you getting into sepsis. And there's so high stats of it even leading to mortality out there. So we always encourage you that if you have a catheter, it's not called a permanent catheter, it's a temporary catheter. The recommended time is 90 days. After 90 days, you have to be able to get a permanent access. And also, like with catheters, you are not able to shower because it cannot be wet. If your dressing is wet, there's a high probability of you getting infected, and we don't want you ending up in the hospital. So work hard, and I'm already encouraged that I've heard that you have working in your fistula. Get your fistula and take that catheter out.
Thank you so much. And thank you for the kind feedback in the chat. We can't thank you enough, Bridget, for taking the time to explain this to us today and for all your valuable insights that you've shared.
My pleasure. That's what I do.
And you're great at it. So we appreciate you sharing with us. And for everyone here, a recording will be available of this webinar as well, so you can revisit it as many times as you'd like. If you missed a note, no worries, you can go back, as well as a few additional resources that Bridget shared with us. So keep an eye out for all of those in your email. We'll be sending that out soon. Other than that, thank you so much again, Bridget, for joining us today and for everyone that took the time to hear.
Thank you very much. Bye-bye.
Okay. We hope to see you all at our next session and hope you have a wonderful day.
Thanks.